Thank you. Before he leaves the floor, let me congratulate Senator Grassley for his very fine work on this legislation, and Senator Hatch as well. It's been a true bipartisan effort. Madam Chair, I want to take this discussion in a little different way. I strongly support the S-chip program. I happen to believe that it is a disgrace that the United States of America remains the only country in the industrialized world which today does not guarantee health care to all of its people. I just came back from a trip to Costa Rica the other day, and this small, poor country manages to cover all of its people, and yet in our country we have 47 million Americans who have no health insurance, and we have some 9 million children who have no health insurance. I always find it ironic that the American people seem to get from the White House what they don't want, and they don't get what they do want. The American people want to end the war in Iraq as soon as possible, a war which will soon be costing us, if you can believe it, $750 billion, $750 billion, which even in Washington is a lot of money. For the war in Iraq, for Halliburton contracts, we seem to have an endless supply of money. The American people don't want it, but that's what they are getting. On the other hand, the American people do want health insurance for their children. The American people strongly support, and the polls are very clear about this, the S-chip program. The American people would like all of the children in this country to be covered. That's what they want, but that's what they're not getting. What this bill, in fact, does do, which is very good, and I mentioned a moment ago my congratulations to Senator Grassley and Senator Hatch for their efforts. It takes us some way. It provides health insurance for 5 million more children, which is clearly a significant step forward, and I will strongly support this legislation. Madam President, it is interesting to me that from the White House, the main argument, it appears, for opposition to this particular piece of legislation, and the reason they are threatening to veto it, one of the key reasons is this is an expansion of quote-unquote government health care. Government health care. Madam President, let me read to you, might be of interest to my colleagues and to the American people, a poll on the economy done a few weeks ago by CBS News from September 14th to September 16th. This is the CBS poll. Question number one, which do you think would be better for the country? Having one health insurance program covering all Americans that would be administered by the government, administered by this terrible government, and paid for by taxpayers, or keeping the current system where many people get their insurance from private employers and some have no insurance. So CBS asked, do you want a government-administered program covering all people, or do you want the current system? And the response from the American people was 55% believe in one health insurance for all Americans administered by the government. 29% want to maintain the current system. So we hear a lot of discussion from the White House about how terrible, quote-unquote, government health care is, and yet what the poll shows, almost by a 2-to-1 majority, the American people would like a health insurance system guaranteeing health care to all people, administered by the government and paid for out of the tax base. When I go back to Vermont I find strong support for the Medicare program, find strong support for the Medicaid program. Veterans want to see a significant increase in VA health care, which is in fact a 100% controlled government program. In fact, the gentleman now, Mr. Nicholson, who is head of the Veterans Administration, former head of the Republican Party, he says, and I think he is quite right, that the Veterans Administration provides some of the very best quality health care in the United States of America, and they have been honored by national organizations who have looked at health care quality and have rewarded distinction to the Veterans Administration, which is, by the way, a 100% government-run health care system. We have federally qualified health systems, health care programs all over America, which time and time again are acknowledged to be tremendously successful. They are supported in a very strong bipartisan way here in the Congress. They provide health care to millions of Americans, government health care. So I think we should perhaps end this boogeyman of government health care. Terrible. In fact, the American people want more government health care in this country. Madam President, our health care system has serious problems. In fact, it is in the midst of disintegrating. We have 47 million Americans today who have no health insurance, and that number since President Bush has been in office has gone up by over 7 million. The cost of health care is soaring. More and more people are not only uninsured, they are underinsured. And despite all of that, our country continues to spend twice as much per capita on health care as any other nation on earth. And meanwhile, despite all of that spending, despite all of the people who are uninsured, our health status measures, including infant mortality and life expectancy and the kind of work we do in disease prevention, ranks very, very low compared to other developed countries. We spend more, we get less value, more and more people uninsured. Healthcare system is disintegrating, and it is high time, in my view, that the United States ends the national disgrace of being the only country in the industrialized world that does not provide health care to all people. Not only are more and more people uninsured, this system is even incapable of providing the doctors that they need, especially in rural America. Yes, in cities we have doctors who are specialists earning millions of dollars a year, but somehow this system can't get doctors into rural America, into primary health care, into internal medicine. We lack dentists all over this country. We have a major nursing crisis such that we are depleting the healthcare systems of the Philippines and other countries because we're not educating our own nurses. So we've got some major problems. In terms of the S-chip program, it is hard for me to understand. It really is hard for me to begin to understand how this president can be threatening to veto this legislation. We hear in the Congress a whole lot about family values. Well, if taking care of our children is not a family value, then I don't know what a family value is. It is clear also that providing health insurance to our children is what is cost effective. Forget the suffering involved. Forget the children who deal with illness that they're not getting treated for because their parents don't have health insurance. Look at the cost-effective aspect of this. What kind of thinking is involved when we say, no, we can't provide health insurance for you, but when you get really sick because you haven't gone to the doctor, oh yeah, we will operate on you, we'll spend tens and tens of thousands of dollars to take care of you when you are in the hospital. So let me just conclude, Madam President, by saying that the time is long overdue for this country to get its priorities right. We should not continue spending hundreds of billions of dollars on a war that the American people don't want. We should not, as the President and some in this institution want, give $1 trillion in tax breaks to the wealthiest 0.3% by repealing the inheritance tax. $1 trillion over 20 years. We have money to do that, but we don't have apparently $35 billion to provide health insurance to 4 million children in this country. Madam President, this Congress has got to reorder and change the priorities established in the White House, and I believe that passing this S-chip program will be a good step forward, a first step forward, to be followed by much, much more. Thank you, Madam President, and I yield back.
Madam President.
The Senator